Hi everybody, I'm going to present to you today the article that I read about the relationship between simulation and nursing education and the medication safety and how that may improve medication administration. This first slide today, I'm going to talk about the significance of the research and the problem that helped conduct this research. The problem is today that medication errors are linked to inexperience and distractions, and that is why we have this study today showing that clinical simulation in the laboratories will help nurses have more confidence in medication administration, which will help with less errors. There are two types of errors. The actual error is when the medication is given, or the potential errors where the instructor had intervened before the medication was administered. The primary question of this study was, does the use of simulation by second year BSCN student in medical and surgical and maternal child placement environment influences the student's ability to safely administer medication? The purpose of the study was to determine that the nursing clinical simulation would help reduce potential errors or the actual errors of medication. While doing this assignment, I had determined that a conceptual model was used during this study. According to Fain, a conceptual model is representing ideas or notions as a set of unique problems that have been a concern for not just the nursing world, but it could be potential any problems or concerns anyone may have. As part of the conceptual model, the meta paradigm in nursing is also linked as well for this study. It does involve the person, the environment, the health, and the nursing. With using these four components, this could help resolve the problem. Next, here we're going to discuss the variables that were part of the relationship between simulation and nursing education and medication safety. First, we're going to talk about the independent variable. An independent variable is the variable that depends to see if there is any effect on any other variable within the study. I had determined that providing simulation experience is part of the independent variable just because if you provide the simulation experience, it may have an effect on medication errors. The next would be dependent variable. A dependent variable is look to see if there was any change once the independent variable was added to the experiment, and I had determined that medication errors would be the part that would be affected, because if you would add the simulation, it could affect medication errors, which would be hopefully a good thing, where there would be less errors due to medication administration. Also, when I was doing this assignment, I had determined that maybe that an extraneous variable might be part of this assignment. When the study is done, it wasn't really determined if the knowledge was actually transitioned over into the real clinical world. So that could have also been a potential variable. I have determined that the intervention used in this research was the clinical simulation. It's an educational experience that was done in the student nurse's laboratory. It would help with self-confidence and would also help with medication errors. Next, here we're going to discuss the sample size that was used during this research study. The second year BSCN year students were part of this study. It was 54 of them from one nursing school. 30 of them were part of the control group, and 24 of them were part of the treatment group. The treatment group were the students that were to see if there was less education error once they had been part of the clinical simulation study. The inclusion part of this study would be the second year students, nursing students, medical surgery unit, and the maternal child unit, and then also the nursing school. The exclusion would be no personal or demographic information. These students were informed about the study that was being conducted, and they had the chance to be part of the study or not part of the study. Those who did volunteer to be part of the study were they became part of a list, and this list became part of the sampling frame. Here we're going to discuss the ethical components of this research. They had sought approval from the Research Ethics Committee. When it comes to any type of ethics, when you're doing a research, it's very important that none of the volunteers or participants' rights are not violated. As part of this study, I had also determined that they had used the Nuremberg Code. I'm just going to list a few of them. One would be that their consent is signed, there's no physical harm to them, and there's prior knowledge done for this study, which was all part of done for this study. Also, we want to protect all of their human rights, such as freedom of injury, privacy and dignity, and that their name is anonymous and confidential, which was all done part of this study because we do not know the name of the school or the name of the participant. So how was the data collected? The data collected was part of a survey that the instructors would use for any individual who had a medication error. These students were put into a group of 5 for their simulation experience. They were given information, and then they were placed within the simulation experience. Once their simulation experience was done, they were able to debrief on any information that they had obtained, and any gap or knowledge gap that they had. They were given 2 hours to determine that knowledge gap and re-evaluate. There was an instrument used to help determine the collection of the data for the surveys. It was the SPSS. It had determined the unit in which the incident occurred, and the clinical instructor, the 5 rights of which ones were missed, and factors that had contributed to the incident. That could have been not paying attention, calculation error. Hopefully that has not an ongoing factor, but it could happen. Also, it had determined that the treatment group had 7 medication errors versus the control group that had 24. The validation for this instrument was done by survey experts. They had determined if the surveys had accurate information, the wording, and appropriateness for this experiment. Here we're going to discuss the results that were achieved during this study. I had mentioned a little bit about the results on the last page, about the experimental and the control group. The best test to be done here was the chi-square test. The chi-square test compares the information of the controlled and the experimental group. They had also used the Poisson distribution as well. What did this study prove? That the clinical experiment did help generate fewer medication errors, and hopefully that would help build more simulation experiments in the clinical setting before students are placed on the clinical floor of a hospital. The experiment group had shown there was only 7 errors versus the control group had 24 errors. So let's talk about the limitations of the study. There were a few as part of this study. There were 2 groups used from 1 nursing program. There was only 2 community hospitals used. There were different clinical instructors, so there could have been a bias, or medication errors weren't written correctly down on the surveys. Replication does need to be done, and the lack of knowledge. Replication needs to be done due to just the small sample size and only one nursing program done. Here we're going to discuss the implication of the practice and how this study may have helped improve nursing. It helped build knowledge gaps for these nursing students where they went back after they debriefed and see where they may have gone wrong. It also helped these nursing students and hopefully freshly graduated students gain confidence in their ability of medication administration, which is also a big part of medication errors. So here we're going to conclude my presentation. This study had proved to be beneficial in improving medication errors, as you have seen on the results. The clinical simulation had reduced the medication errors among newly graduated nursing students, as well as the second-year students. Further studies do have to be done just because there was a small sample size, and it would give us more information if different schools were used and how their clinical simulations may have compared to those of this study that was conducted.